And the third point is even more important. The third point is that make sure you maintain a clear professional boundary. Because the problem occurs when the client fail to see the boundary anymore. Right? You know, the role of the psychotherapist and her path become blurred. So one way to overcome transference is to remind the client of the boundary, or especially in vulnerable clients, give the extra care. Even we try to show kindness, don't touch. Okay, do that too close. I mean, normally it may not be a problem, because here is a vulnerable case. So you have to ensure boundary. So yesterday I talked about a case where I invite that person for dinner because he coming late. So that was interpreted as what? I violated a boundary, right? So anything can be misinterpreted. You never know how the mind works. So to play safe, you maintain a boundary, you're protecting you and protecting your client. And recognize the client's emotional needs and own limitation to meet that needs. So here's the thing. When a client projects their emotional need to you, you recognize there is a vacuum in the emotional life of the client. So you help the client recognize that she has this need, this emotional need for father's love, for mother's love, for a lover. Those needs are met, but there are more realistic ways to meet that need. So help them recognize there's a need there and avoid unconscious acting out. What would acting out happen? When you're burned out, when you're frustrated, when you lose your self-control, when you're under too much pressure. As a human being, you act out. I act out. But acting out will ruin your therapy. Get mad with a client, throw a temper tantrum, that would be unprofessional. Is there any questions so far? Now, use interpretations that resonate with the client. So here's the key, right? Nobody knows the client better than the client himself. At least they would think that way. So when you interpret, you have to interpret in such a way that resonates with the client. Yeah, that makes sense. Yeah. Remember earlier we talked about that the client consider you as a bad therapist if you impose your interpretation on her. You still talk about bad therapist. That's it. Your problem is because of that. You are so sure about your interpretation, which doesn't resonate with the client, you backfire. You make you look like a bad therapist.
Excuse me. Do you have any examples from maybe, I don't know, from your own practice or
example of what?
Of transference being interpreted prematurely and how it can...
Prematurely. I don't put an example, okay, of prematurity.
You know,
well, premature simply means that before there's a firm therapeutic relationship, you should take some time to form, right? If you do interpretation about the client's unconscious mind, you most likely get in trouble. In other words, that has to get to know the client much better. Do not do interpretation too early during the process, because it's a process, right? Usually do too early, it doesn't work. Because you do not know the client enough, and also the relationship not strong enough. The bottom line is that on the safe side, to make sure that she can take a punch or she can take the bad news. Make sure that she's strong enough or the relationship is strong enough for you to reveal that thing she never thought about before. Was that a question?
Yeah, I just wanted,
Yeah, they said, people, I haven't seen any reported about the warning is that don't do the interpretation too early before the relationship is established. Now, how about that? You're a human being, right? I'm a human being. So, you're also capable of transference. Can you give an example?
Probably me and my boss right now. I mean, listening, Marcy's laughing because I think there's a good chance that I need to look at transference and counter-transference in my relationship with my boss right now.
Okay.
Because I do feel I'm acting out, that I'm kind of losing my professionalism. I keep kind of going back to, this is not how I want to be. I mean, and how can I get through to this woman? And why is she doing this? And it is reminiscent of major players in my life, growing up. So I think that I'm just looking at my behavior right now and what I'm thinking, and I think there's a good chance I'm causing transference and counter-transference.
Okay.
I'm expecting her to behave in a certain way. Why would I do that? And when she doesn't...
You're talking your boss, right?
My boss.
Okay.
And when she doesn't, I feel like I'm acting out emotionally, inappropriate to the situation. It's work. She's my boss.
So your boss, been working with your boss for how long? How long?
Oh, this is probably, 18 months?
No.
It's been a while.
2 years, sorry.
Okay, about 2 years. Yeah.
You see, there is so-called the boss syndrome. Have you heard about the boss syndrome? The boss syndrome is that most employees, I'm talking about you, the book I read, okay, boss syndrome is that most people hate their boss. Most people hate their boss syndrome. So whatever their frustration at work, their happiness, they project it onto the boss. So in a sense, the boss cannot win, all right? Because there's so many people there, they project all the frustrations or the angers on the boss. Oh, the boss doesn't understand. The boss gives me too much work. Or the boss doesn't like me. Or the boss favors some other person. Or the boss is not responding to my feedback. Yeah. Or the boss change his favor to another person. So for a variety of reasons, there's a hidden agenda there, other than simply a work relationship. So I'm not speaking from the point of the overall picture. So there is a phenomenon called boss syndrome. So being a boss, usually the boss is feeling feel the heat because he doesn't know how people feel about them, right? About that. Right? So this is the problem. Now, in terms of transference, in terms of counter transference, sometimes the boss will choose a scapegoat, okay, to project all her anger to that person rather than other employees. But whenever he is stressed out or under pressure, so he had to let out anger something to somewhere. So he usually pick a safe target. Say, you know, well, the safe target maybe a minority or whatever. I will project all the anger on that person and say, you're my target. You can do no right. So that's transference, right? Because it doesn't. The test doesn't agree with reality, right? You cannot stand it. She's always wrong. So whatever people's reaction is exaggerated, inappropriate, not supported by reality, usually that element of transference or counter-transference. Usually, okay? A reasonable person can get mad for a reason. You get mad with you without a reason, you say, aha, that's transference. Does that make sense? You're logical, reasonable, but they're doing wrong, you got mad with me. If I have done anything wrong, you got mad with me, where does it come from? Where did it come from? So you begin to wonder, where did it come from? It comes somewhere.
I have been quite watchful, working with abuse situation, and when there's a case, the male was the abuser. When I finish the case, I have to give myself enough time because otherwise, when I go home, I tend to, if my husband was in town, the distance between, I just go, he represents all the male figure because he is male, right? Then I realized that this transference. So I have to be careful that to clear that part up, put it aside before I walk into my home. So the long distance driving helped me. Yeah, so but then I have to be really watchful. But there are times I use it, give me some time, I'm not ready to engage. And he never asked me what happened. So that's one thing as a therapist, I have to be cautious. Yeah.
Teresa is able to handle that because she's capable of doing reflection, right? Reflect the situation, say, look, reflection and also prevention. Think about the situation. So often if you are not in the habit of reflection, you often do things hurting other people, getting people mad with you, or making enemies through transference without even realizing it. Because it's unconscious, right? But right, once you spend some time, we say, why am I so mad with that person? Or why that person so mad with me? You see, you will do some reflection, soul searching, you usually discover the elements of transference or counter-transference. The counter-transference, okay, let's talk about the boss, also our therapist. A therapist can do two things incorrectly. One is transference, and unwittingly fall the trap set up by the client and play the role to meet the other person's emotional need. Play the role of a lover, play the role of a father, play the role of whatever. Okay? Unconsciously, it falls into the trap. They call countertransference because it's your reaction to it's the result of a transference. So in other words, this person identified with what projected onto him. You can also call that projective identification. Right? You identify what is projected onto him. But the therapy can also be guilty of transference. For example, if the therapist has unmet emotional need, whether he's married or not married, if he has an emotional need that's not met, and then lo and behold, it becomes a client who's pretty, who's very tender, and like look his dream woman, okay? He said, looks like the therapist dream woman, okay? So now, the client may not paying attention to the therapist, but she's happily married, whatever. Right? The problem occurs when the therapist began to look forward to the visit of the therapist. Okay, if look forward for the client. Okay, if that client coming late, he get very anxious, and also if the client cancel a meeting for some reason, he gets a fit of depression. Now from that behavior, you know what happened? He has getting emotionally involved with the client, right? So it's normal to like a client, right? But when you get emotionally involved with the client to the point that you cannot function well anymore. You keep thinking about a client, the client doesn't show up late, you got all anxious, got all depressed. So that therapist better need some therapy. Better bring the case to the supervisor and stop seeing that client. Right? Stop seeing that client. So we're all humans and we're all subject to transference and countertransference. So that's Freud's contribution. And whenever you're making a compulsive and thinking responses, that indicating that you are doing transference. Freud, yes.
Sorry, just a question. So when you talk about, if you have a client that doesn't show up, is it just that your emotional reaction is out of line with that? Because I have clients that are very regular, right? So if they're like 15 minutes late, I kind of get in my head, oh, I wonder, like I don't necessarily have a depression or an anxious feeling, but just like I wonder what's happened because of their consistency, right? And so it would be like I wonder what's happened to cause the lateness or to cause the absence, but without that emotional response. So is it just that the emotional response is so maybe visceral, but just like too much?
No, that's too much. See, what you just said is a normal professional response, right?
Right.
No professional response. But this guy, I'm talking about this guy,
Emotionally.
he can't wait to see the client, okay? So why she didn't show up? She's very disappointed. See that there's very different feeling about concern about her. She's very disappointed.
Okay.
There's a strong emotional,
Mm-hmm. Okay, yeah, that makes sense. Thank
Yeah,
you.
because she's emotionally involved.
Yeah.
And she's acting unprofessionally, acting irrationally,
That's what I was looking for. Like
Irrationally,
irrational, emotional response.
inappropriately.
Okay.
You're considered professional, what happened? That professional concern, that reality based.
Mm-hmm.
But here, she's not your girlfriend or a lover.
Right.
If she's late, what big deal, right?
Yeah. Yeah.
It's out of proportion.
I
Now-
find it interesting because very often my supervisor will say, I'm emotionally involved. I am not. And I will say, I'm concerned by somebody who cannot get into their car, and it takes them tremendous courage to come here. All the way, they agonize and suffer. I just want to know if they're standing by the side of a roadside and they're okay. They'll come in when they will. And so for me, that's a very humane thing to do versus somebody telling me that you're emotional. So my sensibility doesn't depend on the client.
Yeah.
My responsibility as a therapist are fully accomplished knowing that they're okay. Even if they're on the side of the road, that they're okay. Why did you take a client to her appointment which is 2 blocks away? Well, she was not in shape and I couldn't keep her in the office. I just drove her over to her appointment.
Yeah.
And sometimes clients don't have money. So I find it very interesting as to who says you're emotionally involved. So it would be good if we could get indicators of what indicates emotional involvement where you've lost where you begin and where the client begins. The enmeshment.
So I'm dedicated, okay? As human beings, there's always emotional part of us, okay? So you react, being a human being, we react everything, not just cognitively, but emotionally. The difference is the intensity, proportionality, appropriateness. If you're concerned for a client being late, it's based on reality, based on your kindness, there's nothing wrong with that. But if the reason for your agitation or depression is because you miss her, that's a totally different story. Do you agree, Josh?
Yes.
He's a guy who understands, right? Steve, you agree with that too, right?
I often ask myself, I'll address that by answering. I often ask myself, is this going to be of service to the client? Am I being of service, or is it about my own need? And, if I can objectively identify if it's about my own need, then whatever I'm attempting to do or going to do, I shouldn't be doing, right? You know what I mean? And you said, it's a personal decision, because, for some people, service is kind of, it can mean more than another person. And I don't think the response is specific. It's individual, right? You know what I mean? Just ask yourself, are you being of service? Or are you being about your own need? And to me, that's the kind of generality that you look at, and if, and then you can't really fail.
And I think, I love those questions you asked, Steve. I think I also am not sure if I trust myself to answer those questions objectively. So that's where I think, bringing in a trusted colleague to be able to give you some feedback about, well, I hear your rationale, however, what about this boundary kind of thing? Because we do, as Dr. Wong said, we're human and we do care, and I think we can kind of take it maybe a bit too far or get caught in some stuff.
Yeah.
So I do like those questions you raised.
You talk about a support network, right? And then, to me, I also look at, there's an objective reality that's independent of you. If, one of the exercises we did in Gestalt was, we did some group work, and then we asked for opinions from the group. And there's a commonality of response, right? And that commonality of response usually indicates what the general truth is there, right? And to me, that's the thing that you look for, right? Independent of yourself, of your own needs, and that's the kind of part that we have to develop as therapists, right?
Okay, thank you. I think Teresa gave us a good example that, all the time we should be aware of the possibility of transferring and counter-transference. If you're not aware of that, you might act without thinking, impulsively, unthinkingly. So that's a danger, okay?